Good afternoon. My name is Kim Shook, Community Education Coordinator with FAIRHOPE Hospice and Palliative Care, home of the Pickering House. And we are here today at Fairfield Medical Center to talk with Dr. Andrew Dagg-Murry, our community infectious disease specialist at Fairfield Medical Center, and our assistant director at FAIRHOPE Hospice. So good afternoon,
Hi,
Dr.
good
Murray.
afternoon. Nice to talk to everybody. We want to talk a little bit about what's in the news, which is COVID-19. We've been doing a lot of preparatory work, both at FAIRHOPE and throughout the community, in order to get ready for this, which is going to impact our community greatly. I just wanted to go over a few things that you may be hearing and make sure everybody's up to speed. And just remember, all this stuff changes almost every day. And the best places to go for information are the Ohio Department of Health website or the CDC's website to get the most up-to-date information. So the first thing I just wanted to mention is to remember that most medical facilities, including FAIRHOPE, like the Pickering House and the hospital, and even a lot of the off-site medical buildings for the hospital are under visitor restrictions. So we're really limiting visitors to just the people that are coming to get treated. And if for some reason you need to bring somebody, you're probably going to be asked to just sort of drop them off and then wait in your car. There is some ability for patients at Pickering House to have some family, but of course we're very restricted on that because we want to make sure we keep everybody safe. One of the things that people want to know is, what do I do if I think I'm sick? I think the first thing is sick would probably mean like a high fever, a cough, or shortness of breath. And if you feel like that, probably the best thing to do first is just kind of socially distance or isolate yourself away from everybody else in your family as much as you can. And then get a hold of your primary care doctor. They don't want you running into their office. Just give them a call and they'll give you some directions. They'll be able to even maybe send you out to the test center where we can check people while they sit in their car out at River Valley for flu, strep, and then if we really don't get a positive on any of those, we'll do COVID-19 testing. But you have to have an order from your doctor, so you got to talk to them first. And just remember, if you're sick, always call ahead wherever you're going, let them know you're coming so that they can prepare for your arrival, and that's what keeps everybody the safest. The other thing is hand hygiene. It's really important that you keep your hands clean. We should be using Purell, or actually plain old soap and water works just as good, and actually sometimes it feels better just to get all those germs and all that stuff off your hands. And do that as often as you can and try not to touch your face. Let me see what else I had here. The other thing is social distancing. I know it's a real pain for everybody to have to try to stay at home and to limit our excursions out to just the essential people that are needed to keep everybody safe and, you know, keep us fed and keep our cars with gasoline and all that. But and of course our emergency responders and police and stuff. But it's really important that we social distance so that we can decrease the spread from person to person of this disease. And what that's going to do is it's going to lower the number of people that get sick. So if we do get sick, we're not all sick at once, and we're not taxing the ability of our hospitals to take care of everybody. So if you have any questions, I would go to one of those two websites and just wash your hands a lot, and everybody stay safe.